Hi, everybody. Um, I received an email today from a colleague who is posting his case history on a cancer patient, and he detailed the specific oncology issues that had arisen and his approach and what he believed to be the correct treatment. And I was thinking when I was reading this report, because it was from an integrative physician, I was um, just thinking about how far integrative medicine or medicine that incorporates many different layers and levels and dimensions of a personal experience, how far we've come. Um, this patient was managed impeccably by oncologists. Insights were derived at from post-oncology or peri-oncology type issues. And when I read through the presentation of my colleague, I was struck by how we can bring so many more diagnostic and therapeutic features to the patient's experience when we consider the layers and levels that any individual ego based or any individual person brings to the consultation. So, this patient, in the history given by my colleague, he just touched on a few issues which could have been further expanded upon and which I'd like to expand upon just to provide a roadmap of how the layers and levels, the seven levels of, or the seven stages to health and transformation can be incorporated when thinking of strictly biologically based medicine. So, in his history, he mentioned that this patient had breast cancer, that she had chemo and radiation and developed side effects. But he went on to mention a few things. A, that she was sensitive, that she had experienced early developmental trauma, that she was a poet and artist, that she had post chemo fatigue, but also happened to mention that she had a supportive framework, a loving husband, and was very involved in her own patient advocacy. So, in addition to everything else that he was bringing to the table, he was wanting to treat her mast cell activation syndrome. He was looking for further triggers as to why she was still fatigued and anxious, i.e., mold exposures or possible Lyme disease. But things that came to my mind in looking through this history were the following. Whenever there's a history of early trauma, you have to look upstream to ancestral inheritance. We know now that individuals carry the experiences of their forefathers. This is well researched, well studied, and now being incorporated into clinical medicine. Whatever the ancestors, particularly the mother, father, and grandparents, had emotionally experienced gets epigenetically transferred into the proteomics and metabolomics, or that, i.e., the cellular expression of that patient's life. You can't ignore it anymore. Secondly, when a person is born into a traumatic scenario, when they have interrupted bonds between the mothers, particularly the mothers in the first 10, 20, even 30 years, there's a price that is paid, particularly if the patient is not entrained with the mother's right prefrontal cortex in an empathic entrainment, one's sense of self, which inhibits early anxiety and stress or fear, doesn't develop a robust mechanism to inhibit should anxiety and stressful events arise in the future. So, in early developmental trauma, when the child's developing brain doesn't entrain with the mother's external prefrontal cortex, and the mother may not have a very robust right prefrontal cortex either, the child pays a price. They pay a price of potentially a fragile sense of self, or even a very undeveloped sense of self and an inability to self regulate. And this is very obviously seen when you do neuroquant MRIs or QEEGs. You can see these fingerprints on the QEEG, on the neuroquant MRI, in the form of an increased amygdala, size, increased thalamus size. They're there, the evidence is there. On a QEEG, you can see heightened amplitude of the beta brain waves, what's called the anterior cingulate area. You can see diminished alpha brain waves. You can see these fingerprints of biographical data on biomedical equipment. It's important to know that. So if somebody is having cancer and has had a very bad sort of chemo experience with many symptoms post-chemo, one does look upstream to any possible inherited trauma from the ancestral realm. One looks at early developmental trauma, because all of these get affected through what's called the HPA axis, the hypothalamic pituitary adrenal axis, in the form of a heightened stress response. And the heightened stress response can create permeability of gut membranes, mitochondrial membranes, blood-brain barrier membranes, leading to a flood of potential autoimmune disease and or inflammatory compounds. So it's important to take that particular history, to look at the brain through a neuroquant MRI, to look at the QEEG to see if there's any fingerprints, and then therapeutically to assist that individual in self-regulation through various techniques, whether they be inside therapy, M-wave training, vagal tone stimulators. I always recommend it's important that people get an insight into the underlying dynamics, not just down-regulate the biochemical or physiological pathway. So when there is early trauma and when there is early developmental trauma, we usually suggest a family constellation therapy insight or family constellation workshop to look at the unconscious dynamics of that inheritance. And for early developmental trauma, again, we use family constellation therapy, but sometimes we have to be more advanced. And instead of doing a technique like DNRS, which just down-regulates the expression of the anxiety that's being felt, you need to do more advanced psychological techniques like ISTDP to look at the defenses of the individual that developed as the child who wasn't safe in their environment, developed a provisional self in order to cope with the slings and arrows of modern life or just the early life. So you've got to look at the family system that's inherited, you've got to look at early developmental trauma, defenses that were developed by that person, and then you've got to look at the ego strength and structure of that individual to see if they have a robust sense of self that can cope with sometimes what is required of them to get their physiology and their health back online. So oncology and cancer, yes, we can give chemo, we do, radiation, we do, of course, plus all the natural therapies. But if you don't look at further upstream to all these potential mediators that keep a person somewhat off kilter, you don't complete your healing interrogation and your diagnostic interrogation. So it's very important to shine your light upstream to look at these potential inherited issues. We know from clinical experience that when you heal at a deeper level from the downstream metabolites and the downstream effects are profound. The body tends to express those consequences of the new images and the new insights and the new narratives in a more cohesive fashion. We say in this work that nobody truly heals until they have a new image or a new narrative or a new story to tell about their past and their present. And this is so vitally true to understand. People who present with extreme complex multi-system illness, it's never only at level 2, which is the physical level. It never is. You can do all the most sophisticated functional medicine workups. You can give them every supplement in the book. You can send them to whoever you want to detoxify, to do bioidentical hormone therapy, etc., etc. But it doesn't land in a robust place if that sense of self is fragile, if the ability to self-regulate is poor, if the defenses of the individual are too fortified and won't allow you in. Because if a child has had an early experience that they're not trusting their parental figures, do you think they're going to trust authorities, medical authorities, which are just external representations of parental figures? No. And no healing occurs without a deep sense of trust. This is this is this is deeply profound, and I've been caught out over the years not taking this seriously and developing an empathic, trusting relationship with the patient, because if that's not established, you might as well give up the rest of it. It's not going to occur. Patients will resist your efforts to help them if there's not an empathic relatedness between you and them, whereby you understand their dynamics, you understand the fortifications of their psyche that prevent healing from occurring, and you relate subtly to what they're asking you to do. Sometimes it takes time to establish a therapeutic alliance and a trusting relationship. If you bulldoze your way in and you tell somebody what to do who has high resistance and also something called projection of will, which means they're asking you to fix them without any advocacy of their own, you're in a precarious position and success is very limited. So in this particular case, I was struck by the fact that A, she had early trauma, B, she had heightened anxiety, C, she had post-chemo fatigue, and the whole world of post-chemo fatigue, of course, has lots to do with mitochondrial dysfunction. So in traditional medicine, we are not taught anything about mitochondrial dysfunction unless it's a genetically inherited mitochondrial disease. Even in functional medicine, mitochondrial dysfunction is paid lip service, and people are given, coenzyme Q10, carnitine, lipoic acid, vitamin C, magnesium, etc. But through the work of Robert Naveau and the cell danger response, we know that the mitochondria also need to be approached with a certain elegance, a certain sophistication, a certain patience, because you can't coax a mitochondria back to health by just throwing everything in the kitchen sink at it, hoping it's going to recover. You have to understand the timelines and the movement through this, what they call the cell danger response, where there's an inflammatory response and the mitochondria shut down to protect the host, and then moving through a healing response, which takes time. Our bone marrow turns over every 4 months, and so the mitochondria too have their own timeline, their own seasons, so to speak. If you're interested in the subject, I'd suggest you read anything by Robert Naveau. And so this patient, yes, she needed chemo. She had post-radiation, post-chemo fatigue. She was highly anxious and wasn't sleeping. But she had resources and she had some insight into her case. So with these issues in mind, it's always important to expand our diagnostic and therapeutic base and try and bring everything to the table to assist that person moving through their present symptomatology of anxiety, fatigue, and gut issues. So this person had gut issues. You have to do a full functional medicine workup with food sensitivities, gut permeability, hormonal HPA axis assessment, methylation, micelle, detoxification. That's just a given. That's just basement workup. But I was struck by how far we've come in the understanding of illness and the fact that illness isn't something that just requires a therapeutic drug. That concept of N squared, D squared, name of disease, name of drug. We're so far advanced. We've become so far over the last 30 years in this understanding. Unfortunately, the healthcare systems that exist are still very mechanistically based, disease-based, which is fine. But when it comes to a true transformative healing experience, all layers, all levels, and interpersonal relatedness with trust are now available to us, and it behooves us as therapists and medical personnel and healers, if you wish to use that word. We have to do our own work, and we have to know how to navigate the nuances and subtleties and levels and layers of a person's experience, and how to read the hidden signs, how to access unconscious dynamics, and how to make conscious that which is being asked to be made conscious. Symptoms are often in a person's life in order to bring to consciousness that which is hidden. It's been said before that all sickness is homesickness. And even though this could be considered a sort of glib metaphor, especially when somebody's suffering severely, it's been my experience that if you really lean into that possibility, the full potential of the person's self-expression can be realized through a sensitive, insightful, and broad palette of diagnostic and therapeutic insights. So these were my musings on a Sunday afternoon, and I just wanted to share those with you. Thank you.